Hello, this is Ian Getman. I'm doing my soapbox on David Rouzer, which is the representative for the 7th District of North Carolina. I am doing mine on healthcare. What I decided to pay attention to was what he voted on and kind of a little bit about what those are. So the first one, which is the HR 986, Protecting Americans with Pre-Existing Condition Act of 2019. This was to give power to the states for waivers of pre-existing conditions. Instead of federally, it would be statewide. And where I got this information from, they said if it was going to be favorable or unfavorable, and this was considered unfavorable. All right, the next one, HR 1628, American Health Care Act of 2017, which also passed. The first one he voted no for. All the rest he voted yes for, by the way. This one passes. Premiums could be higher for pre-existing conditions, but children can remain on parents' health care until they're 26 years old, which would be able to save the government a lot of money, but it also leaves a lot of people out of insurance. That was considered unfavorable. And honestly, there's all of them that he voted for were considered unfavorable but one, and I'll let you know which one that is. The next one, which is HR 3, a budget resolution to begin the process of repealing the ACA. This was not for law. It was really meant for instructions for congressional committees to begin drafting reconciliation legislation to repeal the Affordable Care Act, or ACA. The next one, which is HR 3762, Restoring Americans' Healthcare Freedom Reconciliation Act of 2015. This was to repeal major portions of the ACA, which would mean many people losing their health care. President Obama vetoed it, then they tried to repass it, but it did not go through the second time. All right, so the next one is HR 1190, Protecting Seniors' Access to Medicare Act of 2015. Really what this was to do was to cut provider reimbursement, but provide more tools for cheaper health care. The next one is HR 160, which is Medical Innovation Act of 2015. And this was to create a tax for manufacturers and importers of devices coming in, try to make things cheaper, which the bill passed. And the next one is HR 2, Medicare Access and Chip Reauthorization Act of 2015. There was three aspects of this. One is to repeal and replace the sustainable growth rate. The second is to reauthorize children's health insurance program for an additional 2 years. It was also to continue Medicare transitions away from fee for service and towards value and quality based payments. This is the one that they claimed favorable. The next one is HR 596 to repeal the Patient Protection and Affordable Care Act, and also Education Reconciliation. Really, this was to repeal the Patient Protection and Affordable Care Act, replace Obamacare. And then the last one that he voted on was HR 30, Save American Workers Act of 2015. This was to change full-time from 30 hours a week to 40 hours a week, but only for companies with more than 50 employees. Those are all the things that he voted on, and these are my reference, or this is my reference, healthreformvotes.com. Thank you.